Hi, I'm Aurora Chan and I'm here to deliver you the prime times for February 2016. Our top story is perhaps the top story worldwide when it comes to health and well-being, the Zika virus. This outbreak, seemingly originating from Brazil, has already affected thousands of people and newborn babies in over 20 countries. And with the World Health Organization declaring a global emergency and stating that the disease is likely to spread to nearly every country in the Western Hemisphere, government bodies everywhere are set on alert. Already, Zika has reached the United States and countries as far away as Australia.
The virus itself is only really of concern to pregnant women and their unborn children. Spread mainly by the same Aedes mosquitoes that spread dengue and yellow fever, the Zika virus causes birth defects that lead to infants being born with undersized heads and underdeveloped brains, which could bring on lifelong difficulties for the children. At the present time, there is no known cure for the Zika virus, although scientists and governments alike are working on controlling mosquito populations to aid in preventing the spread of the disease. As another precautionary measure, some countries are even going so far as to ask their citizens to delay all plans for becoming pregnant for as long as the next 2 years.
For now, people should be diligent in ensuring they are protected from mosquitoes, especially for women who are or may become pregnant. Symptoms of the Zika virus include fever, rash, headache, joint pain, and conjunctivitis. People with plans to travel to the West from around the world are already canceling their plans, and while it would be great to report on what exactly the impact of the virus will be, at this point the situation is still both volatile and fluid. All we can do is remind you to be safe and hope that the situation is under control soon. Next, we look at a new idea that could change the way we all experience visiting the doctor's office. Get diagnosed while you wait.
Thanks to a group of researchers in the US, if you show up at your doctor's with generic symptoms like a cough, congestion, or a runny nose, the nurse can immediately take a quick blood sample and load it into a machine, which can then inform the doctor of what is wrong with you before you even see them. This is great news, as before, these type of symptoms could be the result of something as benign as a cold, or from something more serious like pneumonia. So to truly know the issue with the patient, previously lab tests had to be performed that could take up to 10 hours to receive the results of.
Now, thanks to this new idea, time at a doctor's office, both in the waiting room and with the doctor, could be reduced, as better informed and more quickly informed doctors can provide an efficient diagnosis. The researchers also highlighted that this new method could reduce the proliferation of drug-resistant bacteria, as doctors may no longer prescribe antibiotics as a stopgap measure towards fighting a patient's illness before the lab results are received. With so many advantages over current systems, we hope to see this idea come to your doctor's office sooner than later. Finally, there is some news for insurance companies operating in the European Union.
As of the beginning of 2016, a new directive for insurers in the EU, known as Solvency II, now codifies and unites insurance industry regulations in member countries. This comes after over 10 years of negotiations concerning the legislation. Under the directive, insurers can now get a single license that allows them to operate in all EU member states. Not only does this bring EU insurance regulations together, it also aims to enhance consumer protections. Another party that would be very interested in Solvency II is investors, as new regulations will ensure that insurance companies have enough capital on hand to weather potential economic storms. This should bolster investor confidence going forward.
The directive is not without its critics, as some highlight issues such as diversified insurers being favored over insurers that only sell one type of insurance, and others say that the regulation makes government bonds too safe. While a sweeping change such as this may be a headache for insurance companies and agents in the short term, it is easy to see how Solvency II is good news for the EU. Well, that's it for this edition of the Prime Times. We'll be back next month with another dose of health and insurance news. Until then, for all your international health insurance needs, be sure to check out pacificprime.com.